Hello, good morning, Sitaram, and welcome to another program in the series Addiction and Recovery. I'm your host, as usual, Ramnaresh Dwarika, and I want to welcome all of our brothers and sisters in Trinidad and Tobago, up the Caribbean, and worldwide who have been following this program. And I want to take this opportunity to thank all those people who have been sending their comments and their words of encouragement, and even those people I meet when I go out there in the community who recognize me for the work that I'm doing and keep encouraging me to carry this message to all our brothers and sisters who are out there who are still suffering with alcoholism and drug addiction. I want to let you all know, our listeners, that this program is being recorded and it will be posted on YouTube and Facebook soon after the end of the program this morning. It will also be repeated on radio and TV Jagriti at 10 p.m. tonight. So those of you who are unable, for whatever reasons, to follow the program this morning in its entirety, you may be able to follow later on, or you can access it on YouTube and Facebook at your convenience. It can also be used as a resource material, so you can send a link to someone who you believe may be able to benefit from the program. And you can also text any questions you have. I have my number up there, 768-5925. You can text any questions you have, and I will respond to them in the program. Indeed, a lot of the programs that I do is in response to inquiries and questions that people have asked over the last week. So I want to thank those as well for sending in their questions. But today I want to deal with a very sensitive issue. You know, it's like sitting on the horns of a dilemma where you have to be very, very mindful of what you're doing here. And the whole that and this topic today is really the merits and demerits of using drugs to treat drug addiction. This has always been a source of controversy and debate, because some people will come out right and say, look, you can't use drugs to treat drug addiction because what you will be substituting. And then you open up the person to much more problems later on, because it is prescription pills, psychotropic drugs, mind altering substances, although they are prescribed, most of them are highly addictive, and you can become dependent in a very short while. I can tell you that firsthand because I've worked in the field of psychiatry at Port of Spain General Hospital, Ward 8 as the psychiatric unit. I've also worked at St. Anne's Hospital, at Ward 1 in San Fernando Hospital, and at CORA, the Substance Abuse Prevention and Treatment Center. Besides, I have been in the field of this sort of work for more than 45 years now, and I've seen it firsthand. In my practice in recent times, I have been seeing more and more young people and not so young people presenting with not only substance abuse, that is, dependence on alcohol and other illicit substances, cocaine, marijuana, but I'm also seeing a lot of these same people. There's what you call polysubstance abuse now. It is very, very difficult, you know, to find someone who is a pure alcoholic, for instance. And that too has, I know, caused a lot of debate within Alcoholics Anonymous, because when Alcoholics Anonymous was first introduced, and it still holds, its primary purpose is to help alcoholics in particular. The program is designed to treat with alcoholism. But I want to quickly add that that same 12-step program that was developed for Alcoholics Anonymous and is being used all over the world very successfully to help people with alcoholism is now being used. The same 12 steps, 12 principles of recovery are now being used in Narcotics Anonymous, Overeaters Anonymous, Sex and Love Addicts Anonymous, Tobacco Anonymous, Gamblers Anonymous, it is the same principles. And in future, I will again revisit these principles for those of you who are curious. But you can go on your website and you can research it, the 12 Steps of Alcoholics Anonymous. It is there, you can look at it. And of course, if you have questions, you can raise them with me in future programs. So that a lot of people on all kinds of substances that are mind altering substances are now getting a lot of benefit from practicing the program. However, coming back to the whole question of the use of drugs in the treatment of drug addiction in the various hospitals that I've worked, and I have seen, and for good reasons, and I want to at this point make it very clear, I am not a medical doctor. I have been a I have been a psychiatric social worker for many years and practicing in the field of psychiatry. I've also been offering complementary medicine, that is acupuncture, and I will speak a little bit about that. Instead of using the prescription pills to wean people off substance abuse, whether they be illicit or illicit drugs, I have been able to use acupuncture to deal with all the withdrawal symptoms. And I will expand on this later on in the program as we go along. But today I want to explore some of the important and sometimes controversial issues surrounding the use of medication to treat drug addiction. Many people ask, can we really use one drug to treat another drug? You know, and is there problems with this? Now, what are the benefits and what are the risks? In this program, I will be looking at that. I want to be fair to our brothers in the helping profession, brothers and sisters, that is, our medical doctors who have been, and I'm not faulting them, and we'll look at that because what happens a lot of times in extreme cases, especially for alcoholics, for instance, who are over age 45, who have now reached a chronic alcoholism. And in chronic alcoholism, a person who, when they are in withdrawal, like they drank yesterday, and when the alcohol is wearing from the body, they are in, as you said, they are in withdrawal. There are withdrawal symptoms associated with alcoholism and with other psychotropic drugs as well. Marijuana, to some extent, cocaine, and all the other designer drugs, heroin, all of these have withdrawal symptoms once you stop using them. In fact, even behavioral addictions have withdrawal symptoms. And some of these could be depression, some could be anxiety, some could be insomnia. A lot of times for alcoholics, when they stop using the alcohol or they're trying to stop, they start suffering with insomnia because alcohol is a sedative. And when you've become dependent on using it to help you to cope, to deal with depression and anxiety, and indeed to put you to sleep, when you stop, you're going to have trouble. Now, the acupuncture has been found very effective and is being used in England, in North America, in Europe, even in South America. In a lot of treatment facilities now, they're using acupuncture instead of using the allopathic methods that we used, contemporary medicine used in the past, because there has been a high risk. For instance, in New York, in the Bronx, they had introduced the use of methadone to treat heroin addiction because they had a serious problem with people using heroin, and the whole problem with the needle exchange programs and so on that had people using infected needles. Not too long ago, we had the AIDS epidemic, which was further exacerbated when people who were drug addicts, you were using infected needles. They inject themselves, inject others, and now transferring the AIDS virus from themselves to others. I had the good fortune of being part of an international visitors program where I actually was invited to see firsthand what is called the needle exchange program in San Francisco, where every evening, the in a certain park in the city, the drug addicts and a lot of homeless people as well who had become addicted to various substances, especially those that you inject, would line up there. And there was this voluntary organization that would come and they will give out condoms, they will give out tourniquet, they will give out fresh needles and all the paraphernalia to help these drug addicts to use their drugs safely. Now, that was a very hot topic because a lot of people felt that they were enabling addicts and alcoholics to continue to use drugs. But the city explained that they had to settle for the lesser of two evils. Now, you could have let the addicts continue to use the infected needles and infect each other and spread the disease, or that you could have helped them, at least they could contain the epidemic, the AIDS, HIV epidemic at the time. So sometimes, following in that vein, which is the lesser of the two evils? And I think that same principles filters down to when you have to use medication, because there are some people, when they are in the chronic stage of alcoholism or drug addiction, they start suffering with um, mental illnesses. For instance, a young man or someone on marijuana can easily slip into schizophrenia. And now they would have to be managed with prescription medication if they are to be contained, if they are not to become a danger to themselves and others, because it can lead to psychosis. And then there are even alcoholics who have reached to the position of chronic alcoholism, where one of the withdrawal symptoms is called delirium tremens. In delirium tremens, the alcoholic starts seeing and hearing things that are not there. And I have personally witnessed this, alcoholics jumping through a window and running, because they're seeing people or animals or snakes pursuing them. And it can lead to cardiac arrest in some cases, or they can do harm to themselves or others. And as a result, it's a general guideline. Any alcoholic who has experienced hallucinations, there is auditory hallucinations, hearing people talking to you, tactile hallucinations where they feel things crawling on their skin, or they may actually have visual hallucinations where they see people coming to attack them or animals coming to attack them and so on. These need to be detoxed under supervision, and of necessity, they will have to be medicated to be managed. And the medication, I know from experience, is gradually uh, dialed down, and so that they can be weaned off it. Now, the problem here is that in Trinidadians, sometimes we are too smart for our own good. So a lot of people, when they don't go to treatment facility, they start drinking, they have become dependent on alcohol. Now, when they're not drinking or they're trying not, or they've had too much and they're into withdrawal, they go to the doctor, even a general practitioner. And as I say this, in the medical circle, a lot of practitioners themselves, professionals, are of the opinion that, general practitioners should really refrain from prescribing psychotropic drugs. It is really a specialization that should be left to the psychiatrists. They are much more qualified and trained in the field of prescribing psychotropic drugs. But I know, I am aware that there are a lot of general practitioners who prescribe, sleeping pills and benzodiazepine and anti-anxiolytics and tranquilizers and so on. In fact, yesterday I was looking at some prescriptions prescribed by a general practitioner for a relative, and among them was a tranquilizer. And I was wondering why this person is not depressed or anxious, but that's another story. So that the patient, they read the prescription, they Google it, they realize the benefit of it, And they go, and there's a lot. I'm sorry to say this, but I am aware that there are pharmacies that are very unscrupulous, and they sometimes sell these things under the counter or over the counter to people. And then there are people who have connections with people who work in the hospitals and the health sector. And they find ways, Trinidadians find ways, innovative ways to get a supply of the drug. So rather than going back to the doctor and paying a fee to see the doctor, they just go and buy the psychotropic drugs, the sedatives, the whatever. I'm trying to avoid calling the names of these things. And they, they start using it, I mean, in their own, according to what they perceive as their needs. And I can tell you, and a lot of people out there know that any tablet you use, even if you use a painkiller, you use the any tablet, after a little while, if you had a headache and you use two Panadol, for instance, after a little while, if the headache persists, two Panadol may not do the job. You may have to take it more and take it more often, which is dangerous. Even these um, simple little over-the-counter medication, too much of it can damage your liver and all of that, and should not be taken, you know, without the consultation of a medical professional. So, but people are doing this out of necessity. And then what I'm seeing here is a lot of young people at university. I've had students from university who have been brought to me, and they started suffering with depression because of, you know, sometimes you're at university, but you're also at the age where you're into relationships. And sometimes there's a combination of challenges, your assignment, your schoolwork, and your relationship, and dealing with being jilted, and, all these kinds of issues that come up with young people in the formation of relationships and so on. And then the schoolwork starts suffering. They start to become anxious or depressed, or start having problems to sleep because you're waking late, and I know there's people who are start forcing themselves using stimulants to keep themselves awake so that they can study to finish their assignments, and then they disrupt their biological clock, as it were, and now they're having trouble to sleep. They're sleeping in the day when they should be waking in class, or they can't sleep in the night when they should really be getting some rest. And if I dare say to throw into that mix a lot of young people, even in secondary school, who are now on the social media platforms. And the algorithm on these platforms are set in such a way to get you addicted. And I've spoken in the past about, not too long ago, about digital addiction, which impacts your sleep pattern. So I'm seeing a lot of even older patients now who are having difficulty to sleep because they're waking right until 2, 3 in the morning, and then they have to get up to go to work, and starting to result. So you present at your psychiatrist, and the psychiatrist realize, well, look, they'll have to put you on some medication to help you to restore your sleep, or to help you with your anxiety or your depression. And as I said earlier on, our people are so smart, they read the label, see the name of the medication, and they source it without having to go to the psychiatrist. And what I'm seeing in my practice here is quite a number of people now, they following the orders of their doctor, but they're supplementing the psychotropic drug, the sleeping pill, the anti-anxiety pill, the depression pill, is supplementing it with alcohol or marijuana or cocaine. So I dare say when these drugs were manufactured, the researchers did not do tests with it with their clients who were also using alcohol or marijuana. They use it on normal folks. So what can happen is when you take these drugs and then you go and take alcohol or marijuana or one of those, you can not only be putting your brain to sleep, you can put your heart to sleep as well. You can literally, it can be fatal. And I've said that more than once in the past. Now, just at this point, let me just define drug addiction. I have some notes here. You know, drug addiction is often defined as a chronic brain disease with biological, psychological, and social aspects. So, drug addiction not only affects your bones and muscles and organs, not only affects your mind and your feelings and your emotions and your self esteem and all of that, it also affects your relationship on the job, with your siblings, with your spouse, and all of that. And as I say that, it does point, it does indicate that any treatment intervention must consider all these different aspects. In fact, I add to these three the biological, psychological, and social. I would like to add there's a spiritual component. In fact, if you went to Alcoholics Anonymous, they will tell you without any doubt. In fact, if you listen to any one of the contributions that people in recovery give, the first thing they'll tell you is, but for the grace of God, they are sober. It is a highly spiritual thing. A lot of people believe that without God's help, you really can't get out of the obsession. That obsession that drives you to, when you're not drinking, to be thinking about the drinking. So that any program that is developed for intervention must address all four areas: the biological, psychological, social, and spiritual aspects. So that treatment is always multidimensional, which requires intervention methods like counseling, social support, lifestyle change, and sometimes medication. Now, generally, in Alcoholics Anonymous, for instance, counseling, social support, they don't offer counseling and so on as we do in a formal setting. But that is happening in the AA groups, where people get a chance to ventilate. There's therapeutic ventilation, there's social support. All of these groups are support groups, really. And the alcoholic or the drug addict in recovery is encouraged to make lifestyle changes that would ensure that they don't go back to using drugs. Now, let us look at the medication assisted treatment, MAT as it is called, the merits of using medication. As I mentioned earlier, anyone who has become dependent on psychotropic drugs, when they stop, they will go through a period of withdrawal. It is estimated withdrawal from alcohol, the physical withdrawal takes at least 4 days. For marijuana, it may take a little while longer, and cocaine, but generally, but the psychological withdrawal can last a lifetime, where you need to change your attitude, your habits, repair your relationships, and so on. So medications that I used, I know in the Bronx, for instance, they were using methadone. And in some instances, they use buprenorphine and naltrexone. And these help to ease painful withdrawal symptoms. This makes it easier for people to engage in counseling and stay in recovery. I'm sorry about that. So, yes, sorry, I didn't turn off the phone. So, there is a good reason why and as I said earlier on, um, some people go into severe withdrawal where they can hallucinate and so on and become psychotic as well. So that medication must be used to restrain them and to help them to become receptive. So a lot of times alcoholics may have to be sent to the psychiatric ward in Trinidad, for instance, to be cleared and detox before they are sent to other facilities like the substance abuse treatment center and so on. Because if they are under, if they are still not clear mentally, they will not respond successfully to counseling and all of that. Now, my experience is that I know that in a clinic setting, or even when you go to visit a psychiatrist, it is not always, well, time permitting, and I can speak for the clinic, you don't really have time for counseling. In a clinic, most of what is done is assessment and then referral. And the counseling is really left to people like myself, the psychiatric social workers, the mental health officers, and so on, to do the counseling. Now, with medication, you can there's a possibility of lowering the relapse rates, especially in opioid addiction, because the dependence is so strong that a lot of people, even though they're well motivated, they have good insight, they just can't manage to deal with the withdrawal without the assistance of the medication. So, but again, there must be a plan between the practitioner and the patient as to how to wean them off these psychotropic drugs. Now, what I'm really not too happy about is a lot of patients come to me and say, the doctor say, you will have to take this for the rest of your life. You know, and if you have to take a medication for the rest of your life, it means that you are going to never be well. You know, and my common sense tells me that. And what happens in actual fact is that you develop tolerance. At first, the 2 milligrams will help you to sleep of the sedative. But after a little while, 2 milligrams is not working. And so you have to take four and you have to take five and generally it's my experience that medication and even pain medication. And I've heard sales representatives say this at their presentations that look, if 5 milligrams is going to help the person to get over the pain, it is safer to give 10 to make sure, because you don't want to, to half solve the problem, as it were, for want of a better word. So they always suggest that you give, well, it's just a marketing a business as well. Pharmacy is a marketing business. So the more you use, the more money they make. But again, it must be done responsibly. Now we know that every medicine we put in our body has side effects. Some of them we are aware of, and some of them we're not too, you know, and if you read the side effects for even the simple pain medicines that you buy in the drugstore, even in the parlor, if you really read the side effects of those, you'd probably never touch them, because even those can, misuse can be fatal. So coming back to the use of methadone, in fact, methadone has a particular history. They were using it to treat um, drug addiction to heroin in the Bronx. That's where I went and learned my acupuncture. Well, I did further courses there at the Lincoln Hospital in South Bronx. And what they found out, they were having a bigger problem with methadone addiction. Although they were able to get the people off the heroin, now all these people were hooked on methadone and they preferred the methadone, and they were now finding ways to get it and sell it on the streets. So it started to become a business. And that's when one of the psychiatrists, the Dr. Michael Smith, discovered that you could use acupuncture to safely help all of these methadone addicts and heroin addicts to deal with the withdrawal symptoms. Now, I actually practiced at that center and I was able to see firsthand, you know, the work that was being done there. And I had the good fortune, with the assistance of a very good colleague, John Tyndall, to introduce the use of acupuncture here in Trinidad and Tobago at the Cora Hospital. We were doing it there up to not too long ago. And then it was also introduced. I also was able to introduce it at the New Life Ministries, Mount St. Benedict. and I think they still do it there and at the center in Palo Seco. So acupuncture, you can get addicted to acupuncture, but it safely deals with all the withdrawal symptoms. However, I must say, if a person is psychotic, um, you have to take them into an institution so that they can be detoxed under supervision. But generally, acupuncture can deal with all the other withdrawal symptoms. And with the use of medication, you can help people over time to go back to their job while they are working on weaning themselves off the medication. It also helps them to take care of their families and stabilize their lives. The World Health Organization and Medical Association recommend, the use of medication as a key part of treatment. And in my practice here, I've actually I'm seeing a lot of people. I've seen pharmacists, I've seen doctors here. And as I say this, those people who have access to medication are much more likely to start using it. And you'd be surprised, even people who should know better, who know the effect of it, even though it's just like all those people who know alcohol and cigarettes are not good for them. Even the general public, everyone know that you should not be using alcohol in excess, or cigarettes is no good for you and so on. But and even other people who know they're diabetic now and they shouldn't be eating so much sweet things and chocolate, and so many people who have lost so much through gambling know the ill effects but can't seem to stop themselves. And that is what addiction is about. And people who are not addicted sometimes have difficulty understanding and accepting that, look, these are people who are sick. They have become dependent and they need help. They don't need to be stigmatized or castigated. You understand? And that is what this program is about, helping our brothers and sisters out there. Not that I'm making a general blanket excuse for people who use drugs and smoke cigarettes and gamble and get themselves in trouble. While I say that, I am aware that the general population out there are not very, very sympathetic, because these are what you call self-inflicted illnesses where it is seen that the person has some control or should have some control or should know better than to go down that road. So as I said, there is a place for the use of medicine, but it must be done responsibly. And whenever psychotropic drugs are prescribed, there must be an escape, termination plan. There must be a plan, a contract with the patient to get them off that. Nobody should have to be on a psychotropic drug for the rest of their life, right? There's sleep therapy that you can teach people how to sleep without drugs. There's acupuncture that you can't become addicted to. There is counseling. There's so many different strategies to deal with stress. There's cognitive behavioral therapy that can help people to deal with anxiety and depression and low self-esteem and poor coping skills. There's Alcoholics Anonymous that has proven itself to be successful worldwide in helping people, not only alcoholics, as I mentioned at the beginning of the program, but drug addicts and anyone with an addiction problem can use the 12 steps and 12 tradition to help themselves to come off these drugs. Now, some patient may self-medicate and misuse the medication, and I elaborated on that earlier on. And of course, there is the side effects of using these pills where you have people who are drowsy, some people become constipated, some people now become dependent on it. And it can also have disastrous effect on the organs, the liver and all of that. The prescription pills can also damage, including painkillers, you know. There's also the whole question of, the stigma. Society often judges people on medication programs as not truly clean. And that happens. In fact, I also share a view that look, if you are, and I've seen a lot of people going to Alcoholics Anonymous, they realize the alcohol is causing problems. I've seen a number of people, even as I speak, there are people who they realize the alcohol or the cocaine is causing the problem because cocaine causing them to spend all the money and put themselves at risk of going to prison. Alcohol, they can't go to work. They misbehave when they drink. They become violent. So they develop insight. They realize that look, the alcohol is the problem. They want to stop the alcohol, but the doctors prescribe these sleeping pills. So I mean, doctors say I could use that. And it's a hell of a time convincing them that they will have to stop using that because they've become dependent. But the body does not discriminate between what a sedative that was prescribed in the pharmacy or one that you could purchase in the rum shop. The body does not discriminate. A sedative is a sedative, it will put you to sleep. So if you buy sleeping pills in the drugstore or you went and buy alcohol, it does the same thing to the body. So it's like you want to stop drinking alcohol, so you decide you're not going to drink white rum again, you're going to drink red rum. Both of them going to get you drunk. And that's the analogy with if for people who want to stop using the illicit substances or even the alcohol and all of that, but they're still dependent on the prescription pills. You know, they're substituting. And once you're doing that, you really are not going to be able to become what I would call normal in inverted commas. You always run the risk of, and I'm seeing people relapsing with the best intention. They're going to AA meetings, but because of the psychotropic, the prescription pills that they are using on the side, which they and I understand the difficulty. And this is why I suggest people consider the option of using acupuncture to substitute. Those people who come to see me in my practice here, I encourage them to use acupuncture and come off the psychotropic drugs so that eventually you can and in addition to sleep therapy and counseling and all of that, I have had a lot of success, sending people to Alcoholics Anonymous and then seeing them here. I've seen a lot of people succeed in staying over the years, coming off all drugs, licit and illicit drugs. So again, there are limitations to using medication. Some people can't afford it, or they can't go into treatment facilities where you can have these professional care. You have a lot of treatment houses that have literally become more or less custodial. They just take you off the streets, but you don't really have so much of a, a detailed, scientifically based program. I must say, in Trinidad, as I say that, we are fortunate that we do have, even private non-governmental organizations offering rehabilitation services with the support of community-based health centers and visiting. They have psychiatrists and psychologists on standby, trained counselors, and so on. I'm not going to mention names. I don't want to single them out, but I want to, at this point, say medication is not the cure. There's no cure for drug addiction. A lot of people would like to, if there was an injection or a tablet could help their loved one to stop using drugs, oh, they would love that. But unfortunately, that is not so. For some medication, you get temporary relief, but for others, long-term maintenance may be necessary, and that is where the problem is. So that, treatment has to become individualized. It must treat, as I said, with all four areas of recovery. The bones, muscles, organs, yes, the person needs to have proper medical evaluation because alcoholics and drug addicts engage in all kinds of risky sexual behaviors and so on that they can pick up all kinds of STDs, sexually transmitted diseases, or expose themselves to tuberculosis and all kinds of infectious illnesses. So that at the on oh, at the onset, at the beginning, even in the treatment facilities, they need to be screened for these before they are admitted, lest they spread their illnesses among the other people in the treatment facility. So that proper medical evaluation is important for the biological, and then a proper psychiatric evaluation as well needs to be done for the psychiatric aspects of treatment, because a lot of people suffer with what is called comorbidity. You may have a mental illness that led you to drug addiction, and quite often the drug addiction led to the mental illness, and both have to be treated. The mental illness has to be treated sometime before you can engage the person with counseling and other forms of therapy. So what I'm saying is that a holistic method needs to be developed, and unfortunately, our medical system of intervention has become so fragmented. And let me explain that. You have now people who are moving into specialization. You have one doctor who only looks after your bone, the other looks after your eye, and the other is internal medicine, and the other is a skin specialist. And there is not many people are looking at the entire person. You'd have the psychiatrist looking at the psychiatric, the mental aspects of the person, and then you have psychologists who do evaluation of the psychological factors and self-esteem and all of that. And not many, in many situations, you have a holistic look. This is what I try to present in my own practice here. It means taking a lot of time and speaking to the patient, doing a proper evaluation of not only their physical health, but their social support systems, their insight, their motivation, their experiences, the early childhood trauma that might have predisposed them, the genetic factors. All of those should be considered, and these are things that I consider in my own evaluation of a patient. And before developing a treatment plan. And the treatment plan is a contract between myself, or should be between the provider and the patient, where the patient understand their part of the bargain, their responsibility. Okay, so that in recovery now they will have to continue their medication up to a certain point, but they need to understand that they can't continue to be dependent on the medicine. Otherwise, they are really not in total recovery. That they will have to work at weaning themselves, and you need to be willing to work out a plan, offering them alternatives, healthy alternatives, like sleep therapy for the insomnia, good eating habits for the healthy body, and lifestyle changes that will help them to remain healthy physically, and support systems like going to AA, counseling that will help them with their relationships, their self esteem. And also, there are non invasive, non medical, natural systems like not meditation that can help the person to deal with long term issues in recovery, where they learn to become more aware of their mind and how the mind, you know, this is why one of the ways we relate to psychotropic drugs, they are also called mind altering substance. So recovery must include the ability to look at what the mind is doing. You know, our minds have a tendency, our minds could be our best friend or could be our worst enemies. And a lot of what we see in addiction is really related to the mind. The, the belief that I can't live without this, I can't do without that, I can't cope, I don't feel adequate to. I have to take a few drink or smoke to be able to do this or do that. So, that a lot of it is in the mind. And so alternative methods like the 12 steps, which includes meditation, which includes making amends. And I'm going to probably discuss that in one of the following programs so that if a person can be enabled and empowered. They can actually, in the developing the contract, help them to understand, that I can do this. And one of the powerful things is when they go to the AA and the support groups, they see so many people in the world and in their communities who used to have a problem similar to theirs, addiction to alcohol, marijuana, or cocaine, and who are now swearing and attesting to the fact that they have been able to remain sober and drug free, and they are going on with their life. That is a very, very powerful uh, message. Indeed, in your own community, people are seeing people who they knew, used to be sleeping drunk under the shop, who was reduced to almost vagrancy. And now they are all well dressed, looking, prim and proper, holding a good job, taking care of the family, from being illiterate, able to read and write, having a good job, and now maybe a car or two as well. You know, they are aware of this. So it takes very little to convince them that, look, this works. And this is one of the things that happens in these support groups, where people share their experience of how they use drugs, what happened, and this helps the person to identify, look, other people have suffered just like me. And they are speaking about, since they stopped drinking, some of the challenges they have had. So you become aware that, look, it's not a walk to the park. Yeah, there are going to be challenges in recovery. You'll have to now learn how to deal with the same old problems, but not being dependent on drugs, and using new methods to deal with the old problems, talking it out, conflict resolution, all of those things. And eventually, gradually, as a person stops, they are able to start seeing the benefits of abstinence. At first, you're in a short while, your relationships begin to change. People starts to respect you and trust you, and your body starts giving you messages. Look, hey, you have not felt this way in a long time. You are able now to save a little money, and you can meet your financial commitments in a short while. So there are so many changes in so many areas that could encourage the person. But it is important also for the family members to understand that, look, this is a disease. This is not a bad habit. It is not social deviance. It is dependence and it can happen with anyone. Some people are born with that genetic predisposition, but there are a lot of people who, they start using it recreationally and then realize that they could use it to help them to cope and to deal with their low self-esteem and to become the butterfly in the party. You understand? And gradually it leads to dependence, which is not only psychological, but it starts to become physical, where your body literally requires this. And when you don't get it, now you start shaking and you start hallucinating. And then the withdrawal can be so scary and painful that a person won't even want to think of stopping, because the few times they did not have the drink, they suffered and they remember that. So they don't want to go through that again. They develop a fear of not being able to get the substance. And some of you listening there will be aware of the various kinds of stories that alcoholics and drug addicts invent to justify their use and to rationalize their behavior. And those of you who have used will be able to remember those days when you went into withdrawal, how painful it was. And those of you who are actually going through the experience right now, and I want to let you know that you can. It doesn't matter how bad you have gone, how bad you think you have reached, you can stop and help is available. In Trinidad and Tobago, we are very fortunate. We have the Substance Abuse Prevention and Treatment Center at Cora Hospital. Their clinic is on a Thursday. All you have to do is show up there at 8, half past 8 before the clinic, and you will be evaluated and they'll take it from there. You have our clinics in South at the in San Fernando at what is the chest clinic near the Naparima Bowl. In all the various counties, there are psychiatric clinics that is staffed by psychiatrists and mental health officers who visit. They have a roster, you can inquire. And if you have a problem with alcohol or drugs, you have other non-governmental organizations like the New Life Ministry at Mount St. Benedict. They have a branch for women in Palo Seco. There is the Serenity Place in Cochrane Village, which is also a treatment rehab center for women. There's Rebirth House in Port of Spain, and there is Alcoholics Anonymous, where the general service office is at Rivulet Road in in California. Their number is, if you want to reach them, their number is 495-8403. That is 495-8403. That's the General Service Board of Alcoholics Anonymous. And of course, if you want to contact me, my number is on your screen, 671-3040, 671-3040, or you can text me at 768-5925. That is 768-5925. And I'd be happy to respond to your questions, your queries. And yes, if you have a drug problem, you can call me. I'll be only too happy. I also want to send out an invitation to all organizations. I also accept invitations to come and speak to your groups, your organizations on any aspect of alcoholism or drug addiction. As indeed, if we could save one person from going down that road, we're not only saving that one person, we're saving their employer, their parents, their siblings, their communities from which they come from. So I want to thank all of you for listening this morning. And I want to let you know this is an ongoing program. As I said at the beginning, this program is being recorded and it is posted on YouTube and Facebook. All you have to do is type my name in, Ramnaresh Dwarika, Addiction and Recovery in Facebook or YouTube, and you'll access all the programs that have been done over the past years. And you can use it as a resource material. And if you have questions, you can also put your comments there and I'll respond to it. So I want to thank Radio and TV Jagriti for hosting this program as a public service to the entire community and the world, and to thank the staff there for facilitating the program every Thursday. And I would want to say Sitaram and goodbye to you until next week, Thursday. Have a good week. Stay drug free. Those of you who are in recovery, I want to say encouragement to you, go to your meetings. Very important. Thank you again and goodbye.